It's Get Well Wednesday. And the topic this morning is prostate cancer awareness. And here is Dr. Frida Hall. She's the Chief Patient Officer and Executive Vice President at Pfizer. Good morning, Dr. Frida Hall.
Good morning.
All right. What is prostate cancer and how many people does it affect?
So prostate cancer is a cancer that occurs, obviously, in the prostate.
Oh.
This is a small gland in men that's located under the bladder. It starts out as a walnut-sized gland early in life and then grows over time. Now, this gland produces the things that go into seminal fluid, the elements that nourish and transport sperm. How many men have prostate cancer? It's the second most common cancer in men worldwide. Here in the United States, the American Cancer Society estimates that there'll be 174,650 new cases of prostate cancer and 31,620 deaths from prostate cancer in the United States in 2019.
And Hispanics, Caucasians,
Yes.
African Americans?
So prostate cancer affects all men, but not equally. About 1 in 9 non-Hispanic Caucasian men will be diagnosed with prostate cancer in his lifetime. However, if you're African American, the odds, unfortunately, are higher at 1 in 7.
And what are the risk factors?
So I'm going to run through a number of risk factors, but I want to put an exclamation point beside a few of them. So age is a risk factor. You know, prostate cancer develops mostly in older men, with the average age of diagnosis being about 66 years. Now, family history does matter. I'm going to say that again. Family history does matter. Studies show that the risk of prostate cancer increases by a factor of 2 if one first-degree relative, that would be a parent or a sibling, is affected. So in other words, having a father or a brother with prostate cancer can more than double a man's risk of prostate cancer. You've got to ask the question, make sure you know your family history. Race also comes into play. Prostate cancer strikes African American men disproportionately. It's more common, aggressive, and deadly compared to other racial groups, such as Caucasian men. Now, currently, African American men are more than 1.5 times more likely to be diagnosed with prostate cancer and are more than 2 times more likely to die from the disease than Caucasian men. And also, African American men are more likely to be diagnosed at a later stage or more advanced stage of the disease than Caucasian men that are diagnosed at the same age. And last but not least, there are a number of other potential risk factors like diet, obesity, sexually transmitted disease, and maybe some occupational exposures.
And what are the signs and symptoms for prostate cancer to watch out for?
So in its early stages, prostate cancer may cause no signs or symptoms. And when symptoms do appear, they can include things like problems with urination, so a disturbed flow, a frequency, pain, or burning sensations. Sometimes men see blood in their urine or in their semen, trouble getting an erection, and then there's another set of symptoms, pain in the bone, the lower back, hips, or upper thighs, and this can be a sign that the cancer has actually spread beyond the prostate gland. So I'm going to say this one again because it's important. It's important to keep in mind that some of these symptoms are usually caused by other problems. So it could be an infection, an enlarged prostate that's due to aging. So be sure if any of these symptoms show up, you talk to your doctor as soon as possible.
What age should men start getting tested for prostate cancer?
Yep. So remember I went through some of these, some of the risk factors. So most of the time, early prostate cancer grows very slowly. So it's important that older men or those that have the higher likelihood of being diagnosed with the disease, such as African American men, are proactive in monitoring their prostate health by seeing their doctor and then having frequent physical exams. Because remember, it may not show itself to you with a sign or symptoms. You got to go looking for it with some of the tests or exams. So if you have any of these risk factors, you should talk to your doctor about when you should start screening.
So Doc, the reason that African American men have a higher percentage, is it because the way it's checked?
Or that it's not, well, we're not quite sure why the disease may be more aggressive, for example.
Or detection, early detection,
But yes, so early detection is really key. So again, if prostate cancer occurs more often in African American men, think about, so I have a brother that had prostate cancer. This increases my risk, and so I may need to be checked earlier than others. And
he's also talking about the digital as opposed to a blood test, doctor.
Yeah, I was just getting ready to say, sometimes in our community, men are uncomfortable with the idea of a rectal exam. Yes. And so they're like, no, I'm not doing that.
I'm good.
Yeah, I'm good. I'm good, right? So, but you may not be, and so it's important to talk to your doctor. And blood tests could also be used to help detect early the PSA.
And
so we're getting better at detecting early, but we as a community really need to get up and out and make sure that we ourselves, our husbands, our sons, and our loved ones are being checked by their doctor regularly.
Dr. Frida Lewis Hall is with Pfizer, and she is helping us observe Prostate Cancer Awareness Month. And today we begin the feature of our month-long resident health expert, Dr. Frida Lewis Hall, and we will look forward to talking to you next week as we continue our look into health matters. Thank you, Doctor.
And to learn more, get
healthy.
Can
I mention for additional information?
Yes.
Practical, reliable, actionable. Go to gethealthystayhealthy.com or knowyourprostateplan.com. These are two great resources that are brought to you by Pfizer.
All right. Thank you so much, Dr. Frida Hall.
And if you have questions, you can text us at 646464 for the next hour.